Bwe nali sinnafuna bujjanjabi bwa barracks nali bubi, naye bwe namala okubufuna kati ndi bulungi mu kulumizibwa.
Before he accessed palliative care services from the barracks, he had a lot of pain.
Pain is very bad, and especially to patients. They can come with their disease, and they think maybe you as a doctor, you'll be able to remove the disease. And sometimes, yes, you can remove the disease, but in the course of removing the disease, you cause pain, or pain can be part of the disease process.
We live in a region with high rates of HIV, AIDS, and cancer. So we're encountering death a lot, and death is never easy. It's beyond our control, but dying in dignity is not. OSIEA works on the issue of palliative care. What is that? It maximizes the quality of life, and it relieves the suffering of people, leaving them and their loved ones with some peace of mind, even as they face death.
It's really focusing on care for people with life-threatening illnesses. Sometimes we say life-limiting or terminal illnesses, and it focuses on controlling the physical symptoms, looking at the psychological aspect of their illness, the emotional, the spiritual, even sometimes the financial. And it's care that is given actually from the time we make a diagnosis of the disease.
Their lives are not made more difficult by pain. So this ensures access to morphine, which is one of the renowned and recognized pain management drugs, which is highly regulated. And so the work we do is to support groups to ensure that morphine is widely accessible to as many people who are sick as needed.
The morphine consumption in this country has really gone up. We had a very low consumption. Morphine was expiring on shelves, but now even we almost have a shortage of morphine. Well, we don't have a stock out, but there's so much morphine being used right now. They also supported us to do advocacy for taxes on morphine to be eliminated.
It has been a problem to distribute oral morphine to the communities. We have a lot of challenges. The first challenge I would mention is the system itself. The medical stores department has to have a system which can deliver morphine in a coordinated manner so that it should reach to the community. But again, we have the issue of infrastructure. We don't have the good roads which could distribute the morphine to the lower levels.
Patients with the severe pain, normally they can have psychological pain associated with it. So by removing pain, physical pain, you'll be making this patient to be comfortable with his life. So at the end of the day, even compliance will improve.
It's the role of the ministry to ensure that morphine is available in the country. And I think that's a very important step, because then most of the providers are nurses, okay? Out there, they are mainly nurses. We don't have enough doctors to prescribe. So if we had to deregulate the fact that morphine is to be prescribed by doctors to nurses, and that makes it available to patients countrywide.
When I joined palliative care, it was not understood, and they wouldn't imagine that a nurse can stand and assess a patient, prescribe medications for these patients. So like nurses were not allowed to do that. But then the healthcare workers didn't have the knowledge. The doctors didn't have the knowledge of assessing this pain. But as I speak now, what really makes me happy is to see that there are many nurses who have come into palliative care. They are recognized as prescribers, and they are acknowledged and respected by the healthcare system, including the doctors who initially thought that the nurses wouldn't be able to do it. And those nurses who are trained, they really have a passion for the patients. And you can see them going an extra mile to ensure that patients do not suffer pain. Nobody should suffer pain. It's a human right to be pain-free, and they're really respecting that. OSIEA has really supported palliative care to undertake a number of activities that have increased the spread of palliative care in Uganda. The OSIEA gave us money to train healthcare workers so that palliative care could be integrated in the healthcare system, so that these healthcare workers in government hospitals could also start providing palliative care within the government health facilities. And that has helped us quite a lot, because with that money, we were able to open up 6 centers in the government health facilities. And out of these 6 centers, we have 6 hospitals with strong palliative care units where patients are seen and whereby other health facilities refer patients to them. And if it weren't for OSIEA, that wouldn't have been possible.
Having all these diseases, all these conditions, especially the pain, we didn't know the pain management, I must confess. So the coming in of palliative care has really opened our eyes to know and to assess, pain assessment. We didn't know how to assess pain, but now we can assess pain and the patient is relieved of pain. And it's very good to see a patient smile. Patient come with a lot of pain and then he walks out smiling, or like him, when you come, you find him smiling, or when you don't find him smiling, at least you can cause him or her to smile when the pain is off.